those rights real, and that would, could and should make a real difference to those families as well.
Caroline Jones.
Thank you for your statement, Cabinet Secretary, and for providing an advance copy of the ASD Strategic Action Plan Annual Report for 2017-18. I am pleased that the Welsh Government are investing in services and the progress is being made. However, the evaluation of the Integrated Autism Service and the Autistic Spectrum Disorder Strategic Action Plan interim reports by Dr Holtham and Lloyd Jones from People and Work make it clear that there has been a failure to drive systemic change and help create a postcode lottery of support for adults on the autism spectrum. This is not news to any of us who have been campaigning for an Autism Act. The Welsh Government might have good intentions, but people living on the spectrum are not seeing delivery on the ground. Despite the rollout of the Integrated Autism Service, many parts of Wales still have no clear pathways to diagnosis. The interim report highlighted the fact that although funding has not been an issue when it comes to establishing the new integrated service, the regional partnership boards had little capacity for developing the service. The fact that the first integrated autism service was established appears to be down to the hard work and dedication of the national ASD lead. But as the interim report highlights, this is a lot of strain to place one person under. Success or failure shouldn't rest upon the actions of a single individual. Cabinet Secretary, what actions are you taking to ensure that future rollout plans are not reliant on a single individual, no matter how talented? I recognise that one of the key achievements of the Strategic Action Plan was the introduction to the 26-week waiting time target for neurodevelopmental assessment. Cabinet Secretary, can you confirm that this target is being met by all health boards? If not, do you have a timescale in place for when you expect all health boards to meet their targets? And finally, Cabinet Secretary, while I remain unconvinced that Wales does not need an Autism Act, I am prepared to work with you in order to deliver improved services for people in Wales on the autism spectrum, and hopefully in 12 months' time you will have convinced me that legislation was indeed unnecessary. I look forward to seeing what progress can be made in the coming year. Diolch.
Yes, thank you for the comments. I think I've dealt with the challenges and the points about waiting times already, and I recognise what you say about your current view on legislation, but being open to the possibility that we're able to make sufficient improvement, the prospect for more, the legislation may not be something you would support. And I think there is a challenge here about the practical purpose of the legislation that Paul Davies is minded to introduce. And as I say, it's about a shared objective about improving services, about making sure there is greater certainty for families about support that they can expect, and to make sure that the needs of people with autism are properly met. And that is why the integrated service that operates in 4 regions is important for us, because think about the practical services we will need to deliver, the experiences of those families in those areas interacting with the service, their awareness of the service, and equally the frontline staff that we will need to deliver that service. To be fair, you made points about staff as well, and not in particular not relying on a single individual to deliver the whole service, and I recognise that. A service wholly reliant on an individual is not sustainable, or is not a sustainable model to roll out across the country. We can, though, say that the integrated service is seeing a welcome increase in autism expertise as more clinicians are being recruited. The model that we've provided is actually more attractive to staff who want to come into it to work in a way that is joined up with other health and care professionals. And crucially, we're seeing families respond to that and recognise that they are having their needs listened to and met. As I said earlier, that will not always be perfect, but it is a real improvement that we are delivering. And you mentioned the interim evaluation report. And again, it honestly reflects there were differing visions and priorities at the start, but those are largely resolved, and that each region where the service is rolled out are proud of their achievements and recognise they've made a real difference. And that's the point. We want a service that won't just be something that a politician can stand up and celebrate and wave around an annual report, but a service that people would recognise people who work in that service, people who interact with that service and take part in the services that are provided, that is making a real difference, the difference that all of us wish to see